Good morning, and thank you for joining me. Today, we're taking a clear, fact-based look at President Donald Trump's recent diagnosis of a vein condition. We'll break down what chronic venous insufficiency is, why it matters, and how it's managed, without political spin. Our goal to help you understand the science behind the headlines and what this means for millions who share the same condition. Let's dive in. Let's start with the basics. We're going to break down a condition that affects a significant portion of the population, often without them even realizing it in the early stages. It's a condition that can impact your quality of life, but one that is also manageable with the right knowledge and care. What is chronic venous insufficiency, or CVI? We'll explore what it means, how it develops, and why it's important to understand its implications for your health. CVI is when the veins in your legs struggle to send blood back to your heart, a critical function of your circulatory system. Think of your veins as highways, ensuring blood efficiently returns to the heart for reoxygenation, often because the tiny valves inside them are weakened or damaged. These valves are like one-way doors, preventing blood from flowing backward. When these valves fail, the efficiency of blood return is compromised, leading to a cascade of effects. Blood can flow backward and pool in the lower legs, causing swelling and discomfort. This pooling is not just a cosmetic issue. It's a sign that the circulatory system in your legs is under stress. This pooling increases pressure in the veins, stretching them and making symptoms worse over time. Over time, this can lead to more visible signs like varicose veins and spider veins. CVI is surprisingly common. It's not a rare condition, and many people experience it to varying degrees. Up to 40% of adults in the U.S. may have some form of it, especially as they age. The likelihood increases as we get older, making it an important consideration for maintaining overall health in later years. Risk factors include age, family history, meaning if your parents or grandparents had vein issues, you might be predisposed. Obesity, inactivity, both contribute to increased pressure on the veins, exacerbating the condition. And for women, hormonal changes from pregnancy or menopause can weaken vein walls and valves, increasing susceptibility. These hormonal shifts can significantly impact vascular health. A sedentary lifestyle or standing for long periods can also raise your risk, as can being overweight. These habits put extra strain on your leg veins, hindering their ability to function properly. Genetics play a role. If your family has a history of vein problems, your risk is higher. This genetic predisposition doesn't guarantee you'll develop CVI, but it does mean you should be more vigilant about preventative measures. The term chronic means this is a long-term issue that needs ongoing management, not a quick fix. It requires a proactive approach to maintain vascular health and prevent the condition from worsening. Symptoms can start mild, often so subtle that they're easily dismissed or attributed to other causes. Heaviness, a feeling of your legs being unusually tired or weighed down, especially after prolonged standing or sitting. Swelling, particularly around the ankles and feet, which may be more noticeable at the end of the day. Or visible veins, but can worsen if left untreated. These early signs should prompt a consultation with a healthcare professional to prevent further progression. Diagnosis usually involves a physical exam and a duplex ultrasound, which shows how well your veins and valves are working. The physical exam allows the doctor to assess visible signs, while the ultrasound provides a detailed look beneath the surface. This test is painless and helps doctors see if blood is flowing backward or pooling. It's a non-invasive way to get a clear picture of your venous health. While the example of President Trump's diagnosis helps illustrate the condition's relevance, it's important to remember that CVI can affect anyone with the associated risk factors, regardless of their public profile. CVI is progressive, but with proper care, its impact can be minimized. Early intervention and consistent management are key to maintaining a good quality of life. Understanding the basics of CVI helps us see why it's important to manage and monitor the condition. Knowledge is power when it comes to taking control of your health. Millions live with CVI, and it's a manageable part of aging for many. With the right strategies, you can continue to lead an active and fulfilling life. Now, let's look at how serious this condition can get if left unmanaged, and what complications might arise. We'll delve into the potential long-term consequences of ignoring CVI and the importance of proactive care. So, how serious is chronic venous insufficiency? It's a question many people ask when they first hear the diagnosis. Understanding the potential severity is crucial for making informed decisions about your health and treatment options. Let's delve into the different stages and complications that can arise from CVI. CVI ranges from mild discomfort to severe complications, affecting individuals in various ways. The spectrum of symptoms and potential health issues is quite broad, making it essential to understand where you fall on that scale, depending on how well it's managed. Effective management can significantly slow the progression of the disease and minimize the risk of serious problems. Proactive care is key to maintaining a good quality of life. Early symptoms are often mild: leg heaviness, a feeling of fatigue or aching in the legs, especially after prolonged standing or sitting, swelling, particularly around the ankles and feet, which can worsen as the day progresses, or visible veins, such as varicose veins or spider veins, which are often more of a cosmetic concern at this stage. For many, these are manageable and don't disrupt daily life. Simple measures like elevating your legs and wearing compression stockings can often provide relief. If left untreated, CVI can progress. Skin around the ankles may darken, become dry or fragile, a condition known as stasis dermatitis, a sign of worsening circulation. This indicates that the blood is not flowing efficiently back to the heart. In advanced cases, open sores called venous ulcers can develop, typically near the ankles, which are painful and slow to heal. These ulcers can significantly impact your mobility and overall well-being. These ulcers carry a risk of infection, which can further complicate treatment and prolong the healing process, and can be very difficult to treat, often requiring specialized wound care and ongoing medical attention. Another risk is blood clots, especially deep vein thrombosis, DVT, a condition where blood clots form in the deep veins of the legs, which can be life-threatening if the clot breaks loose and travels through the bloodstream. If a clot travels to the lungs, causing a pulmonary embolism, a serious condition that can block blood flow and lead to severe complications. President Trump's doctors reportedly checked for these complications, given his age and other health factors, and found none, which is a positive sign regarding the severity of his condition, suggesting his case is mild to moderate based on the absence of these more serious complications. With proper management, most people with CVI avoid severe complications. This includes lifestyle changes, medical treatments, and regular monitoring by a healthcare professional. The key is early diagnosis and consistent treatment. The sooner you address CVI, the better your chances of preventing it from progressing to more severe stages. CVI can affect quality of life, impacting your ability to engage in certain activities and causing physical discomfort. Causing discomfort or self-consciousness, particularly if you have visible varicose veins or skin changes. But it rarely prevents someone from fulfilling their responsibilities, especially with appropriate management and support. For public figures, the main concern is the potential impact on their ability to perform their duties effectively. Whether symptoms interfere with daily function, such as standing for long periods, traveling, or maintaining a demanding schedule. So far, that's not the case here, suggesting that the individual is managing their condition effectively. The seriousness of CVI depends on how it's managed, and the proactive steps taken to mitigate its effects, not just the diagnosis itself. A diagnosis is just the starting point. The real difference lies in the approach to treatment and ongoing care. Next, let's talk about how CVI is treated, exploring the various options available to manage the condition and improve your quality of life. The good news: chronic venous insufficiency is highly manageable. It's not a condition that needs to drastically alter your life. With the right approach and consistent effort, you can effectively control the symptoms and maintain a high quality of life. Treatment starts with lifestyle changes, often the first line of defense against CVI. These changes are simple yet powerful and can significantly alleviate discomfort and slow the progression of the condition. Regular exercise, especially walking or swimming, helps pump blood back to the heart. These activities engage the calf muscles, which act as a natural pump, aiding venous return and reducing pressure in the legs. Aim for at least 30 minutes of moderate exercise most days of the week. Elevating the legs above heart level several times a day can reduce swelling. This simple act uses gravity to assist blood flow back towards the heart, relieving pressure and discomfort in the lower legs and ankles. Try to elevate your legs for about 15-20 minutes 3-4 times daily. Maintaining a healthy weight eases pressure on leg veins. Excess weight puts additional strain on the circulatory system, making it harder for blood to flow efficiently. A balanced diet and regular physical activity can help achieve and maintain a healthy weight. Avoiding long periods of sitting or standing is crucial. Move around regularly to keep blood flowing. Prolonged immobility can cause blood to pool in the legs, exacerbating CVI symptoms. Take short breaks to walk around or stretch every 30 minutes. Compression stockings are a cornerstone of treatment. They are often recommended by doctors as a primary method for managing CVI. They apply gentle pressure to support veins and prevent blood from pooling. This external support helps improve circulation and reduce swelling, discomfort, and the risk of complications. For many, these simple steps are enough to control symptoms. By consistently incorporating these lifestyle adjustments into your daily routine, you can effectively manage CVI and maintain an active and fulfilling life. If symptoms persist, minimally invasive procedures can help. These procedures offer targeted solutions to address the underlying venous issues without requiring extensive surgery or lengthy recovery periods. Sclerotherapy uses injections to close off small veins. A special solution is injected into the affected veins, causing them to collapse and fade away over time. Endovenous ablation uses heat or laser energy to seal larger veins. A thin fiber is inserted into the vein, delivering targeted energy to close it off, redirecting blood flow to healthier veins. Newer options include medical adhesives that seal veins quickly, often with minimal discomfort. This technique involves injecting a special adhesive into the affected vein, causing it to close and eventually be absorbed by the body. In rare cases, minor surgery may be needed to remove damaged veins. This is typically reserved for situations where other treatments have been unsuccessful or are not suitable. Medications can help with swelling or inflammation, but are usually secondary to other treatments. They can provide relief from discomfort and improve overall quality of life while addressing the underlying venous issues. President Trump's specific treatment plan is private, but it likely includes these standard approaches. Healthcare professionals tailor treatment plans to each individual's unique needs and medical history. The goal is always to use the least invasive, most effective method. Doctors prioritize treatments that offer the best possible outcome with the fewest risks and side effects. With proper care, most people with CVI lead active, normal lives. They can continue to enjoy their favorite activities and maintain a high level of independence. Modern treatments are effective, and recovery is usually quick. This allows individuals to return to their daily routines with minimal disruption. Managing CVI is about consistency, following medical advice, and making healthy choices. It's a long-term commitment to maintaining vascular health and preventing complications. The outlook for CVI is positive with today's medical options. Advancements in treatment techniques and a greater understanding of the condition have significantly improved patient outcomes. Let's wrap up with the key takeaways. Remember, CVI is manageable, and a combination of lifestyle changes and medical treatments can help you live a full and active life. To sum up, chronic venous insufficiency is common, manageable, and rarely life-threatening with proper care. It's caused by weakened leg vein valves, and risk increases with age, genetics, and lifestyle. Early diagnosis and treatment, like exercise, leg elevation, and compression, make a big difference. President Trump's diagnosis is typical for his age and can be managed like millions of others do every day. If you notice symptoms like leg swelling or visible veins, talk to your doctor. Early action is key. Thanks for watching. Stay informed, stay healthy.